Have you ever heard people talk about the male G-spot or the P-spot? It's a topic that gets a lot of attention online, often surrounded by myths and misinformation. I'm Dr. Veena Malik, a urologist and pelvic surgeon, and today, we're going to have an honest, science-based conversation about the prostate. We'll cover why it's such a talked-about subject, what prostate stimulation actually is, and what the medical evidence says about it. Over my years in practice, I've received countless questions from patients. They ask if prostate stimulation is safe, if it offers any real medical benefits, or if it has anything to do with conditions like prostatitis, an enlarged prostate, or overall sexual health. In this video, we're going to break all of that down in a professional, evidence-based, and responsible way, so you can separate fact from fiction. So, let's start with the basics. What exactly is the prostate? The prostate is a small, walnut-sized gland that's part of the male reproductive system. It's located just below the bladder and wraps around the urethra, which is the tube that carries urine out of the body. Its main job is to produce a fluid that mixes with sperm to create semen. During ejaculation, the muscles in the prostate contract to help push this fluid out. Now, because of its location and the rich network of nerves surrounding it, the prostate can be a sensitive area for some individuals. This anatomical fact is the basis for a lot of the discussion around the so-called male G-spot. But it's incredibly important to distinguish between educational anatomy and the sensationalized claims you often find online. Understanding your body is empowering, but it needs to be based on accurate information. So, why do people talk so much about prostate stimulation? In simple terms, prostate stimulation refers to applying gentle pressure to the prostate area. In a medical context, a doctor might do this as part of a diagnostic exam, for example, to check for signs of inflammation or tenderness in the gland. This is known as a digital rectal exam. Outside of medicine, some people explore this area for personal or intimate reasons, seeking pleasure. However, and this is a crucial point, the prostate is located in a very delicate part of the body. Any kind of manipulation, whether for medical or personal reasons, must be approached with caution and a deep respect for safety. Let's look at what the research actually says. First, prostatitis. This is a condition where the prostate gland becomes inflamed, and it can cause pain and urinary issues. In the past, a procedure called prostate massage was sometimes used as a potential therapy for chronic prostatitis. The idea was that it might help clear out blocked ducts in the gland. However, modern medical studies have shown that the benefits are mixed at best and generally quite limited. Because of this weak evidence, it is not widely recommended as a standard treatment by urologists today. This is an extremely common condition where the prostate gets larger with age. The symptoms can be really disruptive, like needing to urinate frequently, having a weak stream, or waking up multiple times during the night to go to the bathroom. You might see claims online that prostate stimulation can shrink the prostate or relieve these urinary symptoms. I want to be very clear about this. There is no strong scientific evidence to support these claims. BPH is a complex condition that is best managed with proven medical treatments, which should always be discussed with your doctor. Okay, so what about sexual function? This is where a lot of the online conversation is focused. Some people do report that prostate stimulation leads to increased pleasure or even orgasm. For others, it doesn't do much at all, or they may find it uncomfortable. The response varies significantly from person to person. It's really important to remember that there's nothing universal when it comes to pleasure. Crucially, I want to emphasize that prostate stimulation is not required for a healthy sex life, for sexual satisfaction, or for your overall well-being. It is simply one aspect of human anatomy that some people choose to explore. If it's something that interests you, fine. If not, that's also perfectly fine. There is no right or wrong way to experience pleasure. This brings us to a very important topic, safety. If you are considering any kind of exploration involving this area, there are some non-negotiable safety considerations to keep in mind. First, if you are experiencing any symptoms like a fever, severe pelvic pain, or difficulty urinating, you should avoid any kind of manipulation and seek medical care immediately. These could be signs of an acute infection or another serious issue that needs professional attention. Second, anyone who has been diagnosed with or is suspected of having prostate cancer should not attempt any form of prostate stimulation, unless they have been explicitly cleared by their medical team. It's just not worth the risk. Third, and this is a universal rule for any intimate activity, It must only happen with full, enthusiastic, and ongoing consent between all partners. Communication is key. Finally, remember that this is a delicate area. Being too forceful or using improper techniques can lead to injury, including damage to the rectal lining or the prostate gland itself. Always be gentle. These points are not meant to scare you, but to empower you to make safe, informed choices about your health and your body. What's the bottom line? 1. Prostate stimulation can be a source of pleasure for some people, and that is a matter of personal choice and exploration. 2. It does not treat an enlarged prostate, or BPH, and it does not reliably improve the symptoms of prostatitis, according to current medical evidence. 3. Safety, open communication, and being aware of your own health status are absolutely essential. There is no magic button for pleasure or for medical cures. Be wary of anyone who tells you otherwise. Your journey with your own body is personal and unique. I hope this video has helped clear up some of the confusion and provided you with reliable, evidence-based information. If you found it helpful, please consider sharing it with someone who might also benefit from it. And don't forget to subscribe for more educational content about urologic and pelvic health. It's a simple, zero-cost way to support the channel and help us continue making this kind of content. As always, thank you for watching, and take care of yourself because you're worth it.